Welcome back. And as was mentioned earlier in the show, we're moving into a conversation about sexual health for the elderly. And we're joined by representatives from the National Council on Aging. We have Executive Director Ix-Chel Poot and Chorine Rivero, Program Officer. Good morning and welcome.
Good morning.
So ladies, National Council on Aging does so much work in terms of advocating on behalf of the elderly population. Let's just start off with a general discussion of some of your ongoing programs at this point. Okay.
All right, ongoing programs. Well, we closed off most of our programs that we had last year, and our first quarter this year was really regrouping, getting things back on the ground. One of the first things that we've done this year has included our sexual health and aging workshop. One of the things that we brought to an end last year was our Adopt a Grandparent program that we're going to be bringing back this year. And there's also other programming that we get caught up in June. We'll be having our Goods Drive for Elder Abuse Awareness. And one of the big things that we are involved in right now is that we are training caregivers with BTEC. That's kind of been our biggest activity so far. There's always been a vacant spot for trained caregivers, and through support from B&E Trust, we were able to get funding to train 80 caregivers for this cycle this year. So the first part of this year, kind of the entire first quarter, we've been caught up in that training and moving that forward. And then the council also celebrated its 14th anniversary in February. We had an intergenerational flash mob.
Yeah, we saw images of that.
Yes, which is, you know, a wonderful activity, mobilizing not only older persons, but also younger people and working people in our community to come out and really support the council and build awareness. And then we had an anniversary cocktail for all our members, and we did a kind of 14-year recap of what the council has been doing. So that's what we've been up to so far.
Of course. And you know, two things that you mentioned. One, I think it's great that you've achieved 14 years of service. But I also think looking at the caregiver situation, that was a very urgent need. What do you find to be, do you find that people are seeking you out to get access to trained caregivers now? Because we think of taking care of the elderly as kind of basic, like people take babysitting to be very easy. What's different?
Well, when we talk about caregiver training, you know, there are three components to a caregiver that people don't always think about. We always think about assistive help, that the caregiver will come in, they'll help to bathe, they'll help to feed, but a caregiver gives the assisted help. They give educational help, because part of what they're doing is they're educating the older person how to take care of themselves, but also the family how to take better care of the older person. And there's also social care, because that caregiver becomes then that person's connection between society and home. So those are three very key components that a caregiver will do. And that's one of the things that this training focuses on. You know, these caregivers, they go through the normal aging process. They talk about different activities aside from just being able to safely move a patient or adequately provide nutrition. So it's about communication and several other things.
Okay, and there we have your flash mob, your anniversary flash mob. So you guys are lucky you have the #1 dance group, easily accessible, Senior Steps, right?
Senior Steps, you know, and this is just our Belmopan group, because there's a group in Corozal as well.
Okay.
So, you know, our Belmopan group gets a lot more attention because they're right where we are, but the Corozal group goes out monthly and visits schools, talking about respecting older persons and healthy aging.
We need a Belize City Senior Steps, so let's hope we see that soon. But let's move into our topic for today. And you know, I think it's absolutely interesting, probably something that nobody thought about. So I have to ask you, where did the idea come from to tackle the topic of sexual health with the elderly population?
That was Miss Rivero's brainchild.
Well, we had recently met with the Women's Department in planning for the activities for Women's Month, and the council needed to do something, and the theme for this year was to be, that was one of the themes that was considered, was to be bold for change and to do something different, to empower women. And our population is not the regular working population, but we figured, okay, we need to do something for these women. What is not being done right now? And what came to mind was sexual health. We don't have programs that are being targeted for women within this age group. We don't talk about sexual health with this age group. And so I had mentioned to Ms. Poot, okay, let's do sexual health and aging. And we sort of played around with the topic. What do we want to focus on? What is it that we want to gain from this initiative? And one of the things we really wanted is to create a safe space for these women to openly start to discuss sexual health. What are some of the things I'm experiencing as I age, and how does this affect my sexual health? What can I do to maintain good sexual health? You know, what type of conversations do I need to have with my healthcare provider, with my doctor? What are some of the things that I need to look for as I age? And so I think that's where it started for us, and after that, things just sort of popped up in terms of like what we can do. I mean, our agenda was packed. One day really was not enough for us, but we tried to maximize on the time that we had with them.
Now, I find it interesting, and you're right. I think it was definitely an underserved population in terms of education on sexual health. What age group were you targeting in women?
The age group was 50 plus. So the workshop was for women 50 plus. We did have some women who were around the age of 48 who did sign up to participate. We had as old as 61. But women 50 plus was the target.
Now here's an interesting thing. We know that ultimately when people, when you talk to people of a certain age, that it is almost unheard of from them to be able to discuss the topic of sex. It was very taboo for them. And you know, even with adult populations in Belize, people still get a little bit wary when you say, oh, we're going to talk about sexual health. So if I imagine when you include the generational gap, I would have assumed it would have been a challenge. Was that the case?
Actually, once they loosened up, they were extremely candid and very frank. And I think it helped because we are talking about experiences and probably not had the opportunity to share these experiences. So being in this environment where they felt safe, where they were surrounded by their peers, where you are with people who are here for the same purpose, it really opened them up to have really candid discussions and talk about things that they've been concerned about. One of my favorite questions that we asked in the beginning was, should older men or older women look for younger partners? And there was kind of a divide, and then there was a discussion on what do you mean by younger and what do you mean by older, and you know, all of these ideas came out about how they perceive themselves. You know, in speaking, you realize how they perceive themselves, and you realize that none of them think that they are old. You know, that concept of you being old is, you know, and then what they are considering to be younger is different from what we're considering to be younger. So
now, here's you know, we have conversations very often about sexual and reproductive health rights on the show. And one of the greatest misconceptions is when we say sexual health, people think only sex. But you're also talking about taking care of your body. And very key to that is also knowing your status. From the women you interacted with, I'm sure part of the education was testing and STDs and STIs. And I don't know how many people make the links, but the younger generation, we've been more encouraged to get tested and see doctors and discuss things like that. But the older generation, not so much.
I think sexual health is important at any age. And I think we assume that as you get older, you either are no longer having sex, or you're married or with a committed in a committed relationship, and so there's no risky behavior happening there. We assume this. We assume this, but a lot of times women, they lose their husbands, they lose their partners, but they still want to enjoy a healthier, active sexual life. And we don't talk to them.
Yeah.
You know, so one of the things we had a presentation from BFLA on STIs and safer sex, and really talking about condom use, you know, for any sexual activity that you're engaging in, regardless, if you feel that you might be at risk, use a condom. Getting tested when you go to do your annual checkups, getting tested, and making sure you ask the relevant questions, because believe it or not, we have a number of women or older persons who are being tested positive for HIV, who are being tested positive for other STIs, and then they're not getting treated, or they might have symptoms and don't even know it. They don't talk to their partners about using condoms because, like you say, condoms is taboo. One of our participants said, you know what, I am 58 years old and I never knew about a female condom until today. They never knew about female condoms. So we're taking for granted that these people, oh, they're older, they must know, but they don't know, and we don't provide the information. The healthcare provider does not initiate the discussion with their patients on safe sexual activities, using condoms, or getting tested, because they just assume that that's not a topic you're supposed to touch. We just assume our parents never have sex because they're older. You know, we don't want to have that discussion that my grandma or my mother is having sex, much less talk to them about condoms. But we have to, you know, we have to.
Yeah, and one of the important things that Ms. Rivero highlighted, you know, we had BFLA there with us, and I don't want your viewers to think that Ms. Rivero and I led any sessions. We actually contacted the Ministry of Health and through the Western region in Belmopan, and also with the help of Dr. Bear, we coordinated to have health professionals there to do these sessions. So these were sessions that were led by people with the right information, with background information, who could really educate the women on what they need to do and where they can go. And even in the discussion with BFLA, you know, one of the important things that she did raise is sometimes you will go to your doctor and you won't be 100% honest about why you are there or something that might have changed. And so you go and say, you know, doctor, I have a least sore throat, and they give you some antibiotics, and that temporarily clears up whatever other symptoms you're seeing, but you've never been open with your doctor. So it's important that when you go to your doctor, you not only tell the doctor the things that you are not ashamed of, but also all the other things, so that you can get adequate treatment.
Absolutely. What was the most interesting result of the workshop that you weren't expecting?
There were a lot of things that came up from the workshop.
It totally blew us away.
Because you really ventured into an area that I don't think people were paying attention to before.
You know, one of the first things, we targeted 30 persons for the workshop because we thought that was a great number. And then following the workshop, there was a free health clinic that included free pap smear testing and free breast exams. And none of the women left.
Oh, nice.
Like, all the women stayed to access the services that were there. They showed up at the BFLA booth and learned how to put on condoms. So, I mean, that was one thing that surprised me.
Yeah. So they did want to speak about their own health.
They did want to speak about it. I think one of the things for me for this workshop is, and I had mentioned this to Ms. Poot, I don't want us to do a workshop where we're just providing information. We need to do a workshop where we are providing opportunities for these women to access the services that they might not normally have access outside of this workshop. Because a pap smear is one thing that women don't like getting pap smears. We don't like to go to get the pap smears. One, because we don't want to go to the public hospital because we don't think it's private enough. And then two, we might not be able to afford the private hospital, and so we just don't get the pap smear, or we don't want to know what the results.
Or we have an idea that it's going to hurt.
It's going to hurt, or we don't want the results of what of this pap smear, and so we sort of keep away from it. And so having the afternoon session where we were able to provide free breast exam, the free pap smear, you know, the free STI screening, having the BMI checks, you know, checking your body fat, your weight, and really looking at all of these things services that we were able to provide in the afternoon, and women taking advantage of this and saying, wow, I felt like I was on vacation. I really felt like I learned a lot. I took so much from this.
Yeah.
So they're not just taking home pamphlets and brochures and information. They went home with a full check, knowing that I did a pap smear, and I'm going to get the results, that I had my breast exam done, and so there's no risk. And if there was risk identified, there was the referrals that were made.
Yeah.
You know, knowing that we've reached women not just with education but with the service was what was really something that I took away. And I think we need to do more of that with all the workshops that we do, not just giving people information but giving them access, giving them tools. The women left with multivitamins, they're left with a care package with so many different things so that they can start. We want you to start to take care of you.
Taking better care of yourself. And you know, we did talk about sexual health, but we also talked about just generally aging well and taking care of yourself and the things that are necessary to take care of yourself. So there was also that segment talking about your mental health and well-being and being able to have outlets and doing things for yourself that many times women get caught up in, because women are traditionally caregivers. So we are busy taking care of everybody else but not necessarily ourselves.
Now, and you say women, and I do want to say that the Aging Council works with all groups, but this was a specific Women's Month activity.
Yes.
Yeah.
You know, we actually we made a public announcement for the workshop at our Senior Steps variety show. We had males finding out,
to sign
up
and asking us, you know, are you going to do one for men?
Yeah.
So there are questions, and it will become necessary at some point in time to actually have a session for men as well. Because there is also that gap. There's always a conversation that women get introduced to the medical system simply because their bodies go through so many changes. And then when a woman becomes pregnant, she goes to the doctor, she goes for the follow-up, there's delivery, there's all that kind of stuff. But there's not that emphasis for men. So men are more than likely to have some kind of health problem that goes unchecked for a longer period of time because they are not encouraged as much to actually go to a service provider and just get checked out to make sure they're okay.
Now, what is your greatest takeaway in terms of whether or not you want to proceed with engaging in this type of workshop in the future?
I think the response that we got from the participants was overwhelming. It was really that gratitude that we're glad that you did this. We have more women who are interested, who want to sign up to do this. So we already know that we can stop worrying about whether or not they will be receptive to this and say, okay, we know that they will. And so let's work on that. And then two, we got commitment from Sancas in terms of the support that they want to give us to do another workshop like this again and to do it bigger. So for us, that's an encouragement that the council needs to work or start planning or preparing to do another sexual health workshop for the aging population.
Of course, your first was held in Belmopan, so I'm sure you have other districts clamoring to have a similar activity.
You know, we actually had people coming from Belize City that drove down from Belize City to participate in this workshop in Belmopan. We had people from
San Ignacio area, Kamalote. So we will definitely look at going into San Ignacio, maybe Dangriga, Stancrick District, maybe Belize City, but we know a lot of things happening here, so.
So this was really and truly the first of many, And, you know, as Ms. Rivero said, that Sancas really came out and supported us. We had support from some of the business community as well. Simon Kwan here in Belize City also supported us. And that's the kind of support that the council relies on, because we operate on a small budget, but to be able to do these kinds of activities, we need to reach out, and it's always encouraging to get back favorable responses and people saying, you know, we're willing to participate, we care about the older persons in our community, and we care about what's happening with these people and how can we be involved.
And I appreciate the fact that one of the things you pointed out was how all the women stayed for the testing services. And that's a success rate in itself. To take information and want to do something about it, it shows that the message has been delivered to them in terms of their risks and what can possibly come or what you need to do to maintain good sexual health. So that is definitely a great indicator, and I commend you guys on taking an additional step in taking care of the elderly population in Belize and offering them services that they need, right? So once again, what else is on the horizon for the National Council on Aging?
You know, the next big thing that we have coming up is our Elder Abuse Awareness Good Drive, our One Action Good Drive. And what that program does is it invites members of the community to donate to the council a pack of adult-sized Pampers, a bottle of Ensure, or a bar of soap. And we create care packages and distribute them to vulnerable older persons, mostly in rural communities. So it's an opportunity for people to literally be able to give back something to people who are in very vulnerable situations. And normally we set up our donation boxes. We did it in Belmopan last year. And we're hoping this year to be able to impact at least 50 older persons with a week's supply of goods. So for any other viewers, they can contact us at the National Council on Aging for more information, how they can be involved in this campaign.
And I love that you clearly identify your needs. So it's Pampers, soap, and Ensure.
Yes. Yeah. The Pampers, of course, is because incontinence and sometimes older persons are bedridden. Ensure is because there is an issue with food security, and sometimes we give older people dry goods to cook, but it's not practical for them to cook, or they don't have materials to cook. But the Ensure offers the nutrition of a meal. And the soap is because in speaking to our HECOPAB units and different units that work in communities, you'll find that an older person will choose to buy food and medication, but will not choose to buy soap necessarily, because they have to make certain choices, and good hygiene shouldn't be something that you're sacrificing.
Absolutely. Well, ladies, thank you for stopping in today and sharing a bit about your sexual health workshop. I think it was a great, definitely hearing from you. It seems like it was well received, and hopefully something that will be emulated in the rest of the country as well.
Well, thank you for having us. It's always fun to be on Open Your Eyes. Remember the last show that we had?
I know, when you made me have arthritis.
And you notice I'm lighter than I was the last time.
Congratulations, you had your baby.
Yes, thank you.
Well, ladies, I gotta say, I think when we think about the aging population in Belize, we often kind of expect that it's just gonna happen on its own, but it's through work that you're doing and other agencies that they can get some of the additional support that they need. So thank you once again.
Thank you too.
Thank you.
All right, we're gonna go ahead and take a break, and when we come back, if you haven't planned anything for Easter yet, there may still be some deals available. We're going to find out with representatives of the Belize Tourism Industry Association when we come back.